I think one of the places where quality measures have room to grow is also looking at those patient subgroups, because not all research captures older patients or patients of various races or adequately addresses the concerns that women might face in the clinical setting. So I think that it's important when the research is being conducted that those subgroups are represented adequately. And I can give you an example. With older patients in particular, there's a measure around atrial fibrillation and anticoagulation. And older patients tend to be under anticoagulated. And if you look at the quality measure around atrial fibrillation, age is a prohibitive factor because those patients do have more of a tendency to bleed. And so when they get in the clinical setting, sometimes there is a concern that if you're given an anticoagulant, that it's going to increase your risk of bleeding. But the fact of the matter is older patients are also at higher risk of stroke. So if they're not under anticoagulated properly, they're at a much higher risk of stroke. So it's sort of balancing those things. And it's important to include the older patient when you're doing the research so that you can capture all of those concerns.